Differences between males and females can cause miscommunication that we might not even be aware of. This is especially important in a healthcare setting because we should constantly be striving to create shared meaning and limit the amount of miscommunication. This concept can be especially difficult in a female patient situation when males are the provider. Women's healthcare is very important because of the impact it has on women each day. In 2009, 211,731 women in the U.S. were diagnosed with breast cancer. Also, just over 4 billion babies are born in the U.S. each year. Between just these two areas of women's healthcare, 4,211,731 women needed to receive some sort of healthcare. It is vitally important that communication is effective in this setting. If healthcare providers are not aware of this, patients will potentially feel uncomfortable and therefore they may not receive the best care possible. Researchers have found that the most common problems with male providers in a female healthcare setting are they focus on technical practice behaviors, not as patient-centered, not enough focus on preventative care, they do not make as strong of an emotional connection, and they are more intimidating.
Our first example shows a male provider ineffectively communicating with his female patient. In this example, Dr. C was only focusing on the biomedical model of medicine. The biomedical model of medicine involves using scientific facts in order to diagnose a patient. He simply looked at her test results and read her the diagnosis. Dr. C downplayed the importance of preventative care by telling her to call back whenever she felt she needed to be seen again.
Come in.
Hey, how are you?
Good.
Well, I just got your test results back and there's good news. You do not have breast cancer, so I guess just let us know and call back next time.
That's it? That's all you need?
Yep, that's about all.
Alright, thank you.
Male providers can overcome these common errors by creating shared meaning, establishing trust, using the communication accommodation theory, and helping their patient achieve high health literacy. Now we will show a clip demonstrating Dr. C effectively communicating with his patient. Dr. C made his patient feel more comfortable by asking open-ended questions. This made the patient more willing to talk about her feelings and disclose more personal information. It was easier for them to establish shared meaning. By encouraging the patient to make her next appointment before she left the office and to practice at-home checkups, Dr. C was promoting preventative care. This helps patients be more aware of their health needs and improve their health literacy. Dr. C used the communication accommodation theory in order to help him be less intimidating to his patient. He did this by minimizing the differences between them and showing he understood her situation.
Come in.
Hi Shelby, how have you been?
Good, how have you been?
I've been good. How was Mexico? Last time we spoke, you said you went there.
Yeah, it was really good, except for I've been really concerned about the lump that I found that I told you about.
Well, I understand your concerns. It's definitely a scary thing to go through, but the good news is you do not have any cancer and everything looks A-okay. I'm very glad that you were watching for these changes because at your age it's really important to make sure you're on top of this as well as making annual appointments.
Alright, thank you so much. This appointment has made me feel so much better.
No problem at all. Be sure to make your next appointment before you leave and I look forward to seeing you again.
Thank you so much.
Here are some ways to create shared meaning. Without shared meaning, it is difficult for both parties to Here are some aspects of communication accommodation theory. Convergence is particularly important. Here are 5 functions of socially constructed illness narratives. Through everything we have discussed, it is easy to see that miscommunications between male doctors and female patients are not uncommon. It is very important to minimize this by working to achieve shared meaning. This ensures that patients receive the best care possible. Male providers should not be the reason women are not receiving the health care they expect and need. By using effective communication, male providers can work to relate more to their female patients and ensure they are providing the best communication and care possible.